In this video, I'm going to do something a little bit different. I'm going to be philosophizing on how thinking that the self, or even another, and particularly another, can actually already has a classification of psychiatric illness. Is very serious, and which is not just harmful to the self, it's mostly harmful to other people. And that's going about well-defining, or more attempting to, not actually well-defining, or engaging well-defined prior existing psychiatric illnesses that are already codified within the DSM-5, the Diagnostic Statistical Manual, and the WHO-10, which is the World Health Organization's best gold standard for diagnosis of both mind and body related illnesses and diseases, which is defined as, and well defined as, Munchausen syndrome. And Munchausen syndrome typically arises in most prevalently within actually mothers, but also often in regards to malpractice of particular physicians who've been typically annoyed from different parental concerns that have been put forth, and who actually go about installing essentially iatrogenic symptoms within patients, who they diagnose and who they push upon other doctors and pressure them to be able to medicalize particular individuals who don't actually have or even perceive directly themselves any symptoms of any serious mental illness or physical condition. And they're often projected to have some serious pain or incapacity to function in a particular way, in meaningful ways, in regards to both the mind and the body, in regards to what is correct and well-defined, good enough and necessary conditions to constitute meaningfully any sort of appropriate prognosis of an illness. And what a prognosis is, it's a prediction, it's an expert's prediction in regards to any sort of particular prior existing rather than non-existing classification of specific appropriate psychiatric illness and mental illness. But also that can pertain to a physical illness. And Munchausen syndrome tends to be very problematic when it comes to mental treatment or psychological treatment and psychiatric treatment specifically, and any form of medical care, because medical care often also pertains in regards to the concerns of a doctor who has engaged in oath to be able to take care, correct, of another individual's mind and body in the correct